Hi, I'm Dr. Paul. And today we're going to talk about gynecomastia. What is gynecomastia? Basically, if you look at the words gyne, women, mastia, breast, it's women's breast formation in men. Why does it occur? There are basically three ages of gynecomastia. It's pubertal, so when you're a teenager getting up to sort of 18, 19 years of age. Then there's middle age, and it's usually associated with medication then. It can also be associated with taking androgenic steroids, so guys at the gym can develop gynecomastia as well. And then there's senility, which we call that old age gynecomastia, when you get into your 70s, 80s, when the ratios of estrogen and testosterone aren't quite right. So those are kind of the ages of it, but what is it and what does it mean for you? What it means for you is that embarrassment of swimming, taking your top off, going to the gym, wearing a tight t-shirt, all the things that you may well be embarrassed about your appearance. So when I see people in consultation, that is quite often what they're embarrassed about. They will not take a shirt off around the pool. They will not sunbathe. They find it difficult in terms of relationships because they don't want their partner to see that they've got these issues. Quite commonly, they're called man boobs, moobs, whatever you want to call them. But we know it as gynecomastia. Gynecomastia itself means a disc of breast tissue underneath the nipple. It's not just fatty excess. If you are overweight and if you lose weight, yes, you will have excess breast tissue. But true gynecomastia, right underneath the nipple, has a very hard, rubbery area. It can vary from being quite small to being really quite large. So by small, we mean maybe the size of a grape or a plum. Large, it can be the size of a small orange or an apple. It can be really quite large and it can be quite painful as well. Does it increase your chance of breast cancer? No, it doesn't. There is an increased risk of breast cancer in other situations, but not with pure gynecomastia. And just having the breast tissue there doesn't mean that you're going to get breast cancer. However, it is embarrassing, it is large, it is painful, it is all those things. So when you come to me, what happens? Well, we'll have a consultation, we'll have a chat. I'll take a full medical history from you. I want to know what medications you've been on. I want to know if you've used anabolic steroids. That's important for me, not just because I need to know whether that's the cause of it, but I also need to know whether you're still on them. Because anabolic steroids and general anesthetic and surgery is a very risky combination. And I will insist that you stop the anabolic steroids before you come for surgery. What happens then? It may well be that we send you off for some blood tests to see whether your estrogen and testosterone levels are okay. Sometimes we don't need to do that, but sometimes we do. Once we've decided what the issues are, it may be something as simple as just a removal of the disc of breast surgery, which will be a cut around the underneath of the areola. That's that red part of the nipple. So we make a cut around there, I lift it up, and then what we do is we shave out that breast tissue. You may need some liposuction or liposculpture to just make the area look a little better, but once we've got the glandular tissue out, that should be it. In the extreme, I've seen men with what look basically like women's breasts. They're very large chest excesses of fat and breast tissue, and what that needs is something like a breast reduction. And by that I mean cut around the nipple, a line down, and sometimes a smiley face scar in the natural crease where the pecs, where the breast hits your chest wall. Now that's a bigger operation, and obviously there's more scarring, more complications with it. What are the complications? Infection, bleeding, scarring. Those are always the big three. Infection very rare, Bleeding always happens when you're doing surgery, but you stop it obviously during the surgery. Occasionally you have drains in place there that come out about 24 hours later. Scarring, it will depend on you. It depends on your skin color, tone, how you heal, how you look after yourself. But scarring can be bad. 99% of the time it's very good. Asymmetry, that's a big one. God didn't make you symmetrical, I will not make you symmetrical. There are differences between the two sides. So think on that. In hospital, overnight stay, usually home the next day. Compression vest, really important. We get you into something like a skins top or a girdle top, and that needs to be worn for at least 3 weeks, possibly 6 weeks, see how things go. We follow you up a week later, 2 weeks later, a month later, but don't expect this to be fully healed for at least 6 to 9 months, maybe even a year. Yes, that sounds like a long time. 2 weeks, you're really quite swollen. 6 weeks, things are getting better, but it really does take 9 months to a year before things settle. If there are little irregularities, little what we call dog ears around the incisions, we can sort them out for you, that's not a problem. So gynecomastia, it is a real problem in men of every age. Peaks at the 20 to 40 age, usually associated with anabolic steroids, but hormones as well. And we operate on it, can do it under local, usually under general. Recovery time, 6 weeks, but 9 months to a year. Thank you for listening and watching. Take care.